all gonna be like, Jenny's crying. I'm like, no, it's my Lyme eye.
Live from the Mighty Veedverks Airship, I'm Travis Lippert, CEO of Verks Unlimited Limited, better known as Veedverks.
And I'm Julie Richardson. I'm the Director of Commercialization and Promotions. And we have a fabulous show today. May is Lyme Awareness Month. So we have with us Dr. Diane Mueller and our Canafam, Jenny Gold.
Welcome.
Thank you.
We're playing Dub Conscious in the background.
Hi.
Get that
We
turned
can
down
dance.
a little bit. Yeah. So I didn't even bring my cheat sheet, but I think we got through it.
I think we do too.
So let's see. Make sure the stream's okay. I think we're good. So let's talk about Lyme. Number one, I always called it Lyme disease, and I've noticed that we just are calling it Lyme now. Is there a reason for that? Or is it
Lyme?
just, yeah.
Oh, we can call it Lyme disease.
Okay, I didn't know if it
Lyme
was
without the S.
That's what I was just about to say. There's a lot of people
There's
that say
no S.
limes. There's
Really?
no S in it's just lime.
It drives the Lyme people kind of crazy when you say limes, right?
It does.
It's like CBDs.
Right.
Yes, it's the CBDs. It's the limes.
I saw an article today that was written by a doctor, and they were talking about getting all your CBDs, and I just wanted to stop that.
Is
Yeah.
it because they're thinking terpenes, maybe, and they're thinking
I think
then
that's
it's CBDs?
because they also said that there's like, I think he said 437 phytocannabinoids in cannabis, which is a number far in excess of anything I've ever heard. So I think
haven't
maybe
heard that
including
many.
the terpenoids is probably where they were at. So
He was smoking.
maybe.
I think with Lyme it may
I know.
I think with Lyme it may come from things like Parkinson's, Alzheimer's, and people get
Yes.
used to that S
Yeah.
on the end of certain disease processes.
Yeah. Yeah.
Well, I am super excited to have you on today because when I went to the website, and I was telling you about this earlier, and your viewpoint, and in the cannabis family and community, we always are talking about the struggle of finding a doctor that will treat us but listen to us, and one that won't argue with us when it comes to plant medicines. And there's so many of us, it's not just cannabis, but we want to embrace all of them. So when I went to your website and saw that you dealt with cardiovascular and other autoimmune issues, and help me, what else do you
Oh, tons. Gut issues, hormonal issues, Lyme, mold illness, diabetes. Yep, insomnia, on and on.
Right. And then on your website too, you can go and get a 15-minute consultation and sign up for it right then.
Yeah.
And how very progressive of you, to do that. Because I can't tell you how many times, and I'm sure everybody else has done this, you go to a website and you're looking at something and you're going to get back to it later.
Yeah.
And that later never comes.
It's so true. It's so true. I think it's so important when we're dealing with health and wellness and really change of any kind that we are really in that forward momentum, right? Because as soon as we take that initiative and take that forward momentum, there's a roadblock. It can really, like you're saying, it can delay something. And it could be as simple as like, oh, I don't have time to make this call or do this right now. And the other thing we really find with Lyme and with other scenarios is that the right fit and feeling into that doctor-patient relationship is so very important. And whether I'm the right person for my clients or not, it's really about finding that right fit. So that's why we do those free 15-minute discovery calls, is really just to have an opportunity to learn more about our practice and our approach, so that people can make sure it is the right fit for them before they commit to any more time or investment.
Right.
And even on your webinar at the end, you say, and you can click here and you can get your free 15-minute session or whatever. And so that's the best, and what you're saying is true, because then you see it, you click it, and you just schedule it right there and then. I mean, you don't have to wait a couple weeks. I waited like 2 days, so which is really nice.
Exactly.
And they call you, so in case you have Lyme brain.
We know all about it.
Right. I know, right. Yeah.
Well,
You know what? Julie's always like clouding up my Lyme brain. It's been a little bit worse. You guys all know this. By the way, I kind of have Lyme right now. We've decided, so I'm not crying yet.
yeah.
Okay, everyone.
Lyme can live in the vitreous humor of the eye. We have a lot of hyaluronic acid there, and Lyme loves hyaluronic acid. It's one of its food sources, so it goes into the eyes. It's also why it goes into our joints, because we have a lot of its food source there. So situations like yours are not uncommon.
And I had never heard of
Lyme
Lyme until I heard the webinar the other day. I was like,
that matches.
maybe that's what I have. Maybe I don't need to be on that antibiotic for
right.
since it's not going away. But
Well,
anyway,
Could we start at a very just basic level? What is Lyme disease?
Great, good question. I love rooting in the basics. It's so important. So it's basically an infection, right? So we have Borrelia genus. We have a Borrelia bacteria that basically will cause Lyme disease. Now, most people have heard of Borrelia burgdorferi, this one of the species of Borrelia. But like we're going to talk about today, like we were talking about earlier, there's a lot more out there as far as species. There's a lot bigger number of species than just that burgdorferi. So simply put, it's just a bacteria.
And how many different species did you say that there were?
So we have about 100 different species in this country, and it's estimated that we have 300 species in Europe. So burgdorferi is one of the species, and the species that we're looking for most commonly. But a lot of the symptoms that we see associated with Lyme disease can be caused by any of these species. So right now where we're at is, as we're testing, for example, in labs, we're really only looking for at maximum a couple of these species. So it's really important to realize that there can be a lot missed in the Lyme testing world.
These are bacterial species.
These are bacterial species, yeah.
I'm glad that you
Absolutely.
just brought that up, because a lot of people think that Lyme is a virus, and it's not a virus. So, we can talk about those co-infection viruses, because some of the co-infections actually are viruses, correct?
There can be co-infections that are viruses, that are parasites, that are bacteria. So absolutely. Even fungus. We can even look at some fungi as co-infections in their own way.
My head has been itching for like 45 minutes now. I want somebody.
We all know Travis. He's like, well, we need this.
Somebody check me for ticks.
He might have gotten one in his front yard. We were just discussing that, the deer. Sorry.
When you brought up
Probably
something, not only is there 100 just in this country,
Yes.
of what we know, but how it affects an individual, like if we both, had the diagnosis, I may not have nearly the symptoms she does, or vice versa. And then what we're seeing with different canafam that have Lyme is we'll have flare-ups or episodes, and it'll just be horrific, and then it stops almost as quickly as it comes on.
So you bring up some really, really good points, and some of the difference between why one person is going to say react to Borrelia versus another person, it comes down to genetics, right? We do have genetics that can make us more susceptible to having post-Lyme syndrome. And so if we have those genetics, then we have more of a likelihood of the toxic effect from Lyme building up in our system, and we can see some of the more detrimental types of effects. So that's one area. And then the other area that's really important as far as why some individual symptoms are so bad and others are, less severe, can be also in looking at the totality of what's happening, right? Because Lyme, when we're talking about Borrelia, we have to remember, like you mentioned co-infections, Jenny, we have to remember that when a tick or a mosquito or a flea, whatever bites us that delivers Borrelia, it doesn't just give us like the one little specific bug that it just says, I'm just going to drop this one bacteria off. It gives us that whole cocktail of whatever actually is contained in that insect. And so some of what can make one person say symptomology worse than another's is simply that the cocktail of infections that they have is maybe more widespread, more larger number than another person's.
So you guys, we have a good friend, Stacy, who has pain. Her pain in her joints and her pain is out of control, right? I don't have pain in my joints. So why does one person have the pain in their joints and not another person? And it's just because that little tick or mosquito or whatever, we'll get to the mosquitoes later, drops off that one little extra thing but they didn't drop off in me, right?
It can definitely absolutely be that. Another
Yeah.
thing that this is something that I've just seen clinically, and I've never seen research that shows this, so I just want to differentiate that, is people that tend to be a lower body weight, we tend to see more neurological things more commonly, and people that have a higher body weight, oftentimes we see more joint pain. So that's, that's
I've
not
never heard that.
that's not
Good to know.
something, there's,
Yeah.
it's not textbook. It's not something that I've ever seen a research study differentiating.
Right.
Just a trend that we've noticed in clinical practice. And then there's certainly people that
Interesting.
have both, that have the cognitive
Oh, yeah.
changes and the neurological changes and also have the joint pain. But that's just an interesting clinical thing that we'll see sometimes. So it's possible theoretically that there might be something to do with weight that's also impacting the influence there.
Would you call Lyme, I can say Lyme disease, right?
Yes.
I just, right before the show, I went to get people coffee and go to the bank, and I heard on NPR, which makes it, I guess, official for me. I've seen it on the internet before, but they've turned like the circle game that we always used to play in formation, like 4chan turned that into like a white supremacist like hand signal. Yeah. It's so
I don't know that. I need to learn that.
Yeah.
I
so
need to learn
just
that.
didn't want, so
I don't ever
with
do it.
would you call Lyme disease an idiopathic disease? Is it? I mean, the origin is known, but you were saying earlier that some doctors don't even believe that it exists.
I wouldn't call it idiopathic, but I would definitely say the awareness around the frequency of it it's not really known, right? So we see, for example, that it's like the CDC even talks about it being a clinical diagnosis. If you look up on the CDC webpage, when they're talking about Lyme on their webpage, they'd say, oh, this is a clinical diagnosis, and lab tests are used to support the diagnosis. So what clinical diagnosis really means is that we make the diagnosis based upon symptoms, not based upon the lab test. So we use lab tests to come in and give us some support. But what a lot of people are doing in the Lyme world is doing like a diagnostic, like lab test type of diagnosis, and saying, well, if you can have all the matching symptoms, and if this lab test that frequently is only testing for 1 out of 100 or 1 out of 300 strains, if that lab test is negative, then we're just saying, well, those symptoms are not, they're either not real, it's either in somebody's head, or there's just another unknown reason.
Oh, he is not pulling up a tick. He is. Oh, I don't like that.
I remember reading. I remember reading one time,
Like
and I don't
creepy one.
remember where it was, but I thought I saw a map one time that showed where the prevalence of Lyme overlapped significantly with MS.
Yeah, absolutely. MS, where there's an article on ALS even. So we're seeing, some of these neurological things like MS and ALS and other forms of dementia.
The Lyme doctor, sorry.
Yeah.
The doctor in Colorado Springs, can't remember his name for the life of me. He was diagnosed with ALS literally on his deathbed, couldn't even talk anymore. Somehow he was able to do that thing where they think, and it comes out on the computer, and he's like, you need to test me for Lyme disease. Put me on these antibiotics, and they did. And now he's walking.
Right.
And you know who he is. For some reason, I can't think of his name, but we've all seen him, and he totally came out of that.
Yeah.
Yeah, there's a Rockies player that he diagnosed with Lyme, and he's fine now for the most part, from what I understand. So, so a lot of these people are diagnosed with MS, ALS, and they go on the antibiotics or the natural path, right? Or
herbs and
stuff. They come out of it.
Absolutely.
And so a lot of my friends with fibro and everything else, I'm trying to get them, even with epilepsy, trying to get them tested or do something or come in to see you.
Yeah, treatment. Yeah, we always, I think one of the biggest things with Lyme and medicine in general is really always asking why, right?
Right.
So when we're talking about things like plaques on the brain and these changes in the, in MRIs and imaging, one of the things, excuse me, I have a frog in my throat all of a sudden. Thank you. One of the things to really remember thanks so much, with the plaques, is that we don't just make plaques in our brain for no reason, right?
Mm-hmm.
So it's thought to be that we're actually
Right.
making them as a protective mechanism against something.
Mm-hmm.
So what is that protective mechanism coming
Right.
for or coming from?
Like amyloid plaques.
Correct. Yep, exactly. So, some thought is that it's that we have infections there, like these spirochetes. There's also thought that there's a hypoxia situation of low oxygen to some of the cells in the brain, and we create the plaques almost like a protective mechanism from some of these certain conditions. So the question is then, what are we protecting ourselves from? Why is the body doing this? And it's a really important question. And I don't think we know all of the answers. We're doing that yet, but we know some of the answers. And some of the answers sometimes it can be Lyme and mold illness. And those are two really common answers.
I was put on Plaquenil. And you know what? They put me on an MRI machine again. Gone. The plaques were just gone.
Plaquenil?
Plaquenil, and that is like
Plaquenil.
toxic. That is not one that you want to be on, but I had no more plaques.
Right.
But now they're like coming back again as I'm getting worse here. Unfortunately, in Colorado, it's getting worse again. So it's kind of like, what do we do about that? That's why I'm going to see her at 3:00.
Well,
Right?
and,
Yeah.
I had never put it like that. We know in our veins, our body produces plaque, and for the little. So I had never thought about what is our body protecting our brain from.
Exactly.
That is really interesting.
Exactly. Yeah. And the vasculature is very similar. There's a reason why those plaques are being laid down. Sometimes there is a genetic thing for sure, where cholesterol, there's just a lack of the ability for cholesterol to absorb into the cells to be used.
Right.
So there's absolutely this genetic component where it could be as simple as that. But sometimes we can have a lot of oxidative stress, and we can have these toxins, and we can get some damage to the arterial walls due to this. And the plaque is a compensatory mechanism for that reactive toxic stress that's happening.
Well, it's interesting that MS also the plaques. Do we know what causes the plaque in MS?
I mean, Lyme, we're thinking for MS, for ALS, and for MS we have that that breakdown of that myelin, right? So the nerves are not firing correctly. And definitely, it's not always, I want to be clear that this is definitely not like a situation where MS and ALS and these types of diseases are always Lyme disease. But absolutely, we're finding that one reason for them, especially in situations where we have, I have a couple clients with Lyme that would have a pseudo MS type of diagnosis, where they're being told, we're going to call this MS, and it mainly looks like MS, but it doesn't fit perfectly.
I've gotten that diagnosis, yeah.
Yeah, that's a big red flag, right? For let's look for something that's causing this very similar thing to happen, which certainly can be Lyme disease.
But the whole microbiome thing that we were talking about earlier, they're saying that all these different autoimmune diseases, ALS, Parkinson's, MS, Alzheimer's, Lyme, it's all kind of your gut too. So how important is it, that we're dealing with that, with any of these infectious diseases? Yeah.
Big time. The microbiome project's a really exciting project, right? Because we're learning more and more about all of these individual microorganisms in our gut and our sinus cavities, for example. We know it's not just the healthy organisms in our gut anymore, right? They're all over our body. And we even know there's a viral, there's viruses that are actually good viruses that are living in our bodies too. So it's really exciting what's coming out.
Name one.
I can't name one, but good question.
I know, right?
Well, we know we have good gut bacteria.
For sure.
You didn't
She has
talk
good
today.
butt stuff.
Yeah,
but,
I have good butt stuff.
I know.
Oh, I just pounded this thing.
Every time you pound that
sensitive.
table, it costs me about 20 minutes later on.
In editing.
Yeah. Okay.
I keep my ring away from
That's an
it.
exaggeration.
Save you time.
Yeah.
That's awesome.
But I think in your point, around the microbiome, one of the things that's super important is really understanding that our bodies are all connected.
Right.
We have lymphatics, we have cardiovascular system, we have nervous system that connects our toes to our head, to our ears, to our nose.
Yeah.
And so what's going on in the gut, what's going on in the sinus cavity, what's going on in the vasculature, all of these areas are going to make a difference with the treatment of Lyme. And
Right.
the more we can be in a place of health in these areas, the better the Lyme treatment's going to go, especially when we think about like almost 3/4 of our immunity is actually in our guts, in our small intestine. And so if we're asking our immune system to do a whole lot with treatment of these bugs, how can we do it if our gut's not functioning well?
Right.
So
Right?
can you help people with diet?
Oh, yeah.
What they should and shouldn't be eating and things like that? And
Yeah,
can
absolutely.
you pull in the cannabis side of it too after we talk about the food?
Yeah.
Well, because we did talk about that a little bit, but the CBD, the THC, all of that.
Sure. So from a dietary perspective, one of the biggest things that I feel just about everybody with Lyme and everybody with a chronic scenario needs to be off of is gluten. And some people will say, well, I don't feel bad from gluten. I don't react to gluten. And sometimes we can even test their blood and their immune system's not reacting to gluten. But here's the
That's
thing.
me.
Gluten causes leaky gut
It does.
in everybody. So for a temporary time period. So, and with leaky gut, when our gut gets leaky, what happens is we get more reactions to food. We get more immune reactions to food. And so when we're talking about an immunodysregulation, like with Lyme, where we're trying to fight things and we're not succeeding often, then we need to make sure our immune system is as healthy as possible and is not fighting things that are supposed to be our friend, like food. So that's one thing there on diet. So just kind of a blanket across the board thing that I think is very safe to tell people is get off of gluten, make sure you're not on any sort of GMO type of products, make sure you're eating organic, and then get off of any sort of crazy sugar. So a little honey, as long as it's not crazy amounts of honey, some fruits, some stevia. Stevia is actually very anti-Lyme. These types of sugars are okay, but
It's
any of the
gross.
what's that?
It's gross, though.
What's gross? The stevia?
Stevia.
You know what? Stevia, though, I have a terrible reaction to it.
See?
It's probably because you're actually killing some Lyme. I wonder.
I mean, I'm like,
Got
all of
the
a sudden I'll
herpes.
be like, I gotta go to the bathroom. I'm like, sorry,
Oh.
people, don't mean to be gross. But yeah, I just like, all of a sudden I get a really bad headache and it's kind of crazy.
Yeah, I mean, you might, if it's like coming on that fast, it's possible you also have an actual allergy to it.
That's what I'm thinking. So sorry, everybody that keeps sending me all those articles about stevia. And I'm like, no, that doesn't work for me. It does work for some people. So
It does work for some people.
One of
Yeah.
our viewers suggested that maybe it was Dr. Martz in Colorado Springs.
it was Dr. Martz.
Yeah,
And I can't see who
Canada.
that is, but thank you so much
It's
for
MV Parpal.
Okay. So it is Dr. Martz, and if you know him, you've seen how much he progressed. Now, I had never met him, but I did meet him at this what do you call it, conference type of thing. And I'm like, hi, Dr. Martz, how are you? And he's like, it's so great to see you. And I'm like, he's like, I haven't seen you forever. And his wife looks at me and she's like, he's never met you, has he? And I'm like, no, he hasn't, but that's okay. So, but he did speak on this panel. And he knew so much. He knew so much about Lyme, and they're doing a lot of research. They did have a big research clinic down there, and they were talking about all these different autoimmune diseases in the brains of all these different people after they had passed, obviously, but and how they were finding spirochetes
Exactly.
in ALS, in Lyme, in Parkinson's, in Alzheimer's, like all these things. It was really kind of crazy.
Absolutely.
Yeah.
Yeah, that's very clear at this point.
Yeah, right?
Mm-hmm.
So you guys can take my brain when I'm gone. Except Nick Muir wants it. He already told me. Sorry, he wants to download it, he said. I was like, okay.
So
You want it too?
if I do find a tick on myself, which I'm convinced I'm going to do any minute now. One time I worked on this product for lice. I say product, it was a comb. It was a prescription comb. It was a total scam. And but my head just itched constantly while I was working, like writing about like all these lice. But so if I go home and inevitably find a tick somewhere under my headphones, what's the first thing I should do?
Good question. Number 1, don't freak out.
And don't just
And
pull
then
it.
what?
Don't just pull it out. The worst thing you can do is just pull the thing out because, right, you explain why.
Well,
You can leave little bits in
yeah,
there.
we just want to make sure it doesn't get stuck inside So that's one of the biggest things.
How about lighting a match and...
That doesn't really work either. Yeah, that doesn't really work either. You can get a tweezers and gently pull and gently twist it a little bit to get it out. So
But,
that's
like,
one way.
What do they call the needle nose? Not needle nose. Oh my god,
Like
that would be like
the pliers you're talking
yeah,
about?
no, yeah, the pliers. Get the pliers. If it's that big. I mean, if it's that engorged. No, the little tweezers that are like really, really sharp.
Mm-hmm.
I've heard those are the best, but who carries those around?
Yep, exactly.
Really? I mean,
I feel like keeping a pair in my wallet right now. So if you,
Yeah.
I think you should.
So do take the tick out though. Don't go to the doctor.
You do want
and
it
show
out,
them.
but here's the thing: a great idea if you actually find the tick is save it and send it in. Get it tested.
that.
You know, that's what because the erythrema migrans, that red bullseye rash, only shows up in about a quarter of the population with Lyme. And so we can actually test the tick. That can also give us some insight into if there's Lyme. We're not testing the tick, unfortunately, for all 100 species, but we can at least get a little bit of information and at least know if we find a positive in there.
Yeah, those are all the bullseye. He's pulled up.
Because even if you just test positive for like Babesia or Bartonella, should people actually start getting treated for Lyme then also?
So here, it's a really interesting question. So there's definitely some people that really feel that the Babesia, the Bartonella, the Ehrlichia, these common co-infections always have to have Lyme with them. That to me does not make a lot of theoretical sense, especially when we know things, for example, like 90% of cats have Bartonella, right? That's why it's known as cat scratch fever. Do I believe that 90% of cats also have Borrelia? No. And so... So when we're saying that if we're bitten by or we're scratched by a cat and we get Bartonella, I don't believe that everybody has Lyme. So they're different bugs, and they can be that's the classic rash. That is the classic rash. So if you get this rash in some ways, we can say the silver lining of this is that you know for sure. Right? So obviously we don't want to be infected with Lyme, but it's really nice to at least know for sure if we are. Right. So that's the benefit
of the rash. And that's only 25%, you said?
Yeah.
Wow.
How soon does that rash appear?
Quickly. Yeah, quickly. I believe, to go back and look, but I believe it's within that first month. But that's something I should look at the exact number of weeks on. So
but if you can't get into your doctor right away, or if you can't get to an emergency room, you probably have a cell phone with a camera these days, so take a picture of it, at least so it's documented, so your doctor doesn't say, oh yeah, you got that off the internet. So at least you can show them something.
Yep, I agree with that. And smart.
Should you draw a circle around it or anything? Like, is it like a staph infection? Or...
It's not like a staph or a cellulitis where you're really worried it spreading and getting bigger. So we're not dealing there with like a situation where there's like a skin infection that we're worried about spreading. So you don't actually need to do that with this. It's just more of a signal that there's actually Lyme there. That infection is present.
And are we seeing an inflammatory process right here? Is that what the redness is? Does it feel hot?
Typically can feel hot.
Does it hurt?
Not necessarily. No, not necessarily.
If you push on the red and let go, is it like a sunburn? You know how you test a sunburn and you let your finger off and you're like, oh wow, my skin used to be.
I do not know the answer to that one.
I haven't heard that, but
I haven't heard that either.
Look that up. We can look that up.
I hope we never find somebody that has a bullseye to test it.
I know.
So
I know.
You said if you can't get in to see your doctor, like that wouldn't even cross my mind at this point. I would be right there at the urgent care clinic, immediately.
Right.
Like, is there any benefit to acting quickly versus?
Oh, absolutely.
delay?
Absolutely. I mean, treatment, if we can catch it quickly, what we don't want it to do is switch into its intracellular form, start burrowing deeper into the body. That's when it can become even harder to treat.
Is that you too?
Oh yeah.
That was totally me. I mean,
I
wasn't diagnosed for over 2 years, so that is like the best thing if you can just get in to somebody, even if they give you doxycycline or whatever in the emergency room, just take it and then get into a doctor like yourself, right? But just do something, because you don't know, like you were saying, you don't know if you're a bit like that day or if you're a bit a month ago. You just don't
Right.
know how long that little tick or the big tick was in you, wherever that was.
Right.
Will you tell us the life cycle of the Veedverks?
It replicates about every 3 to 4 weeks. So what's super interesting about the pharmaceuticals, right, is the pharmaceuticals will actually only kill Borrelia in its replicating phase. And so when we're on these pharmaceuticals, sometimes for years at a time, they're actually only active killing about 1 week a month. The rest of the week we have to be on them. The rest of the month we have to be on them because we don't know when that special week is that they're actually in their replicating cycle.
So
There's
people,
not a test for that.
It's not a test for that. No, if anybody is in the lab testing world, like there's so much need for more advanced lab testing here, and it would really, really help us, us doctors with better diagnosis and patients with better treatment.
so many people. Oh, sorry. So many people say that their Lyme gets worse when the full moon comes out, but that. I know that's very common with epilepsies also.
Yeah.
So do you think that Lyme patients just kind of say, oh, well, that's when I'm going to get worse? Or do you think that's really what's going on?
It's interesting. I hear this in the parasite world too. A lot of my patients with parasites will talk about how the full moon, their symptoms get worse. And, really, I can't say anything super specific from a research perspective about what's happening here. But I do know that I've seen enough patients report this, that there seems to be something very real happening here, and it could be just the natural flows of hormones through our body in a cycle. It could be that, we are, I believe, really influenced by nature, by the world around us. And, and we know this, right, from even, the classic thing that I like to talk about with the moon is just we know the moon's effect on the tide.
Right.
We know moon has an effect on water, and we're such a large percentage of water that it's a little bit of a jump from a research perspective, but we could make a theoretical argument there. And certainly I do see it clinically. People report that.
Talk to any emergency room doctor.
Yeah.
There's a reason they call it lunatic.
Right.
Well, I also
So
hear
that's
this with women's cycles.
Yeah.
And then all of a sudden their Lyme's worse during their cycle. So it's like, if that's not during the lunar phase, then is it worse then? Is it also worse? So are there 2 phases for that or not? Or I've never really had an issue with either of these things we're talking about, but I do have a lot of friends that bring that up.
Yeah, I mean the cycle thing is to me takes me back to the idea that we're a whole organism. We're one body, one mind, or one body mind, we could even say. And so if somebody has more of a tendency due to Lyme or due to other factors to have like an estrogen dominant scenario, which is most common, where that relationship to estrogen and progesterone is like this, it's very, very common that we would have symptoms that are worse around our cycle.
Right.
And if we're not having that hormonal support, and we know with Lyme, stress and diet and all these little things can really throw Lyme people off, it makes sense that hormone abnormalities could do so too.
Stress.
Storms.
Hear that, Nick? Stress. You don't bring me a lot of stress though, Nick. I love you. But so I completely agree with the stress thing for any autoimmune disease. I know I keep talking about other autoimmune diseases, and we're talking about Lyme today, but I really think it's important that we consider all these different autoimmune diseases today, because I do want people to get tested, but your doctors might think that you're crazy, except for her.
I won't think you're crazy. That's true. There's other of us that won't think you're crazy too. I know a lot of great doctors in the field.
That's good.
Yeah.
So the main
They believe in the Lyme.
Absolutely.
Yeah.
The main Lyme tick is a deer tick.
The main Lyme tick is the deer tick. Yeah. There's also other ticks like the Lone Star tick. And so the Lone Star tick is basically causing what's known as the alpha gal allergy, which is basically where all of a sudden we start reacting to things like red meat. So if you're noticing that every time you eat red meat in particular, you're having a lot of problems, digestive problems or insomnia or these types of things after you're eating red meat, it's totally possible that you could have that particular scenario going on.
What's the drawback to that, except just you turn into a vegan? Like, is that also harmful to your health?
Yeah, I mean, it's a different infection in your body, right? So we're talking about all sorts of different infections, and they all play a role, and certainly some of them play a larger role than others. But if we're having a scenario where we have 10, 15, 20 different things, which sometimes people do, every little component of those that are, say, dysregulating the immune system or causing the immune system to react is certainly a tiny piece of that overall pie.
So deer ticks are called deer ticks, I assume, because they're found on deer. Mm-hmm. Do deer get Lyme disease?
Not that I've ever heard of. Not
Which
that I've
is
ever heard of.
Interesting because they have found the Borrelia in the deer meat. Mm-hmm. And they did have to. I remember when I was diagnosed in the early 90s, they did have to kill a ton of cattle because they were finding in the dairy. And I think it was Missouri or Kansas.
They were finding Burgdorferi in milk, in cow's milk. That's gross.
Yeah, did you hear about that too?
I did not hear about that. No.
Yeah, it was like late 80s, early 90s.
Okay.
Yeah. And they got rid of a lot of them. But I also have heard that when you run into moose, which I don't know how often we run into moose up in the mountains, if you see a lot of their fur that's been rubbed off on the trees, it's because they do carry a lot of ticks and that they're trying to rub the ticks off.
Yeah.
Deer too.
Mm-hmm. Yeah, that makes sense. That makes sense. Mm-hmm.
So, I don't know. That's all I know. That's all I know. I'll be quiet now. You're like, no.
do the ticks get sick from Lyme?
Do the ticks get sick?
Yeah.
I've never had anybody ask me this question.
I don't know.
I really don't know. I don't know if ticks have ever been studied on that level to see if there's behavior change or anything else.
We have to study them because we must figure out how to kill them all. Every tick.
Well, I find it interesting that Congress, I believe it's Congress, the bill was just taken to Congress about they're going to do like $1 million and getting rid of ticks. So what are they going to do? Spread like insecticide across the entire United States? Like you can't do that.
Yeah, I don't know.
So
how
I
would
don't
happen.
I know I don't understand how they can actually do this.
Well, and then like you and I talked earlier, we know there's other vectors, right? We know mosquitoes, and now we know fleas, and so it's not just ticks. So if we went on this war against the
sorry to everybody, I'm like, we don't want to tell you these things.
That's really scary.
But we really need to tell you these. And so what I was going to say about that bullseye rash.
Yeah.
So a lot of times when people get bit by a mosquito, in Michigan when I was a kid, you get bit by a mosquito, and all of a sudden you're getting these big welts, right? And they get hot and they get red. We don't want you guys to be running into the emergency room every single time you get bit by a mosquito, right?
Exactly.
So how do they figure out if that's a mosquito that has Lyme?
It's, there's not, unfortunately, a perfect solution for this. I mean, usually if somebody is going to have Lyme, there is an initial type of flu-like symptoms. Mm-hmm. So that's a pretty big red flag if you get bit by an insect and then shortly after that, within a few days or within a week, you're feeling like, I'm feeling a little fluish. Mm-hmm. So if that happens, I would certainly consider that could have Lyme. Now, the question always is like, if we don't know, do we want to run out and put ourselves on these strong antibiotics that are going to cause detrimental effects to other areas of our body? Mm-hmm. So if, I know if like I ever caught Lyme in an acute situation, I'd probably do something like doxycycline. There's enough supportive evidence of that. But if we're in that don't know phase, of like there's no way, there's nothing coming up on a lab, but I was bitten by something and I'm just a little nervous, that's when I would get into the, it's more of the Lyme herbs. And, the herbs. And if you want to know about herbs, an easy resource is just looking up Stephen Buhner's work, because he has some really great research on a lot of the herbs and very well laid out.
How do you spell Buhner?
Is it Beuhner?
Is it B-U-E or B-E? I think it's Buehner.
Okay.
I think.
Could be.
But
I can't remember if it's
I can't
remember if it's E-U or U-E. Spelling is not my strong point.
Well, that's, thinking about West Nile virus,
Yeah.
And the spread of mosquitoes, and the thinking that Lyme can be spread like that.
Right.
And coming from an area of the country where, boy, the CDC really jumped on that in that area. And what do you hope to see happening as far as prevention? Because you can't just kill all bugs.
Yeah.
There's,
Right.
don't get me singing
Watch
Lion
me try.
King, but,
That was
Circle
just on
of
TV
Life.
the other night.
Yeah, it was
I know,
on last
right? It
night.
was. It was Circle of Life.
Dragonflies eat hundreds a day. We love dragonflies.
Totally. Yep.
So we don't want to
Yeah.
get rid of, all of them. There's a purpose for it. So, what can we do to be proactive in our health and our family's health?
That's a really great question. And so some of it is as simple as making sure that we're just taking good general care of ourselves. We're getting enough sleep, or we're doing some sort of mindfulness-based activity that's helping our system be calm. Stress is really important. I'm going to give you a specific example of why in relationship to this conversation. So Lyme has biofilms, right? So biofilms, for those that don't know, are kind of just protective sheaths. They're usually made of like protein and carbohydrate that are around a microorganism that actually kind of acts as a wall of fortress for against our immune system from being able to attack that bug. So epinephrine, otherwise known as adrenaline, the stress hormone, when we are stressed and we increase the adrenaline in our system, what that does is it actually causes the biofilms from Lyme to grow, to become stronger, to be created. And one of the things that those biofilms do, and besides protecting the Lyme, is the biofilms also allow all the different bacteria of Lyme that exists there in the body to talk to each other. So it's almost like increasing their cellular communication, right? These biofilms. And that happens every time we get stressed. So, in relationship to your question, that's why, doing these things of like stress management and really working with those stress responses can be extremely, extremely helpful.
Right. Good. And then,
she's giving me the look. I was like,
then, you have your regular, it's summertime, you want to make sure that your pants legs are tucked into your socks. But, we do all these safety protocols, say we're going to the mountains. But if we're going to just go play in the park, a lot of people don't think tick safety.
Yeah, absolutely. So when we're in our front yard, when we're mowing the grass, when we're playing with our children, when we're just doing normal summer things that hopefully we're all doing because nature's so wonderful, we need to consider that there can be ticks there. So making sure that anytime we're playing outside, that we're in nature, we're really checking ourselves, our children, our animals for ticks, making sure that none of, the people and species we love possibly could have it. And then also doing things like drinking cistus tea internally can be really helpful as well.
What kind of tea?
Cistus, it's an herb.
How do you spell it?
Cistus. So drinking some of that can help prevent some of that Lyme internally as well. And then, the natural ways of preventing bite. So we know things like DEET, for example, but citronella actually can come, it comes in essential oil.
Excuse me.
And that's very natural. It's not going to have any toxic chemicals. And we can actually spray that on us. And I've had very good results in situations where I'm camping and my friends are getting bitten and I'm not getting a single bite because I'm smothering myself in this oil. So that can be really effective as well.
I also read a paper that talked about eucalyptol being a good terpenoid DEET type of product. We have a question from our live audience. For those of us freaking out right now, what's the percent chance that the tick that bit you has Lyme versus a safe tick? Are there how many ticks have Lyme?
I know there's a stat on that.
I don't know.
I forget the stat on that, honestly.
I didn't look up that stat. I did look up how many ticks or how many how many people get it in Europe.
Yeah.
In Western Europe, 300,000 or 330,000, they think. That was like in 2018. And then here they're saying, which is very interesting, they're saying this is an old stat too.
It is.
In the US for 330,000 a year. That was from when Under Our Skin came out.
Right.
So that's 20 years ago.
Well, and we're using core diagnostic methods like the ELISA that we know has a lot of false negatives. We're only looking for 1 or 2 species depending upon the company. So when we think about the testing, we know it's a lot higher, but unfortunately I don't know the exact statistic on the
Pennsylvania
ticks.
said they had 300,000
cases
reported.
alone.
Yeah, so
The
how can
incidence or the prevalence?
No, they had 300,000 incidents reported. So how can we have 330,000 in the U.S.?
I don't want to go to the Poconos camping.
Sorry, people.
Jeez.
But I mean, this is all online, but it's a little bit disturbing, right?
Oh, it's very disturbing.
Did you just mention the name of a book or a documentary or something, Under the Skin?
Under Our Skin.
Under Our Skin. Is that a movie or what is it?
It's a documentary.
It is. Yep.
And there's Under Our Skin 2 that's out now. And it's really interesting because my doctors are in one.
Oh yeah. Mm-hmm.
They're in one of the
movies.
The first
They're in
one.
the first one.
Okay.
And then my other doctors are in the second one. And I can't believe that they are.
Yeah.
Because then they're targets. They're targets. And, but.
What do you mean by that? The doctors are targets?
Yeah.
For being in the movie?
Yeah.
Targets of internet hate?
No, not so much that. It's
Big Pharma silencing?
Yeah. It's Big Pharma.
We read about you, Merck.
It's
I read about that.
Well, it's Big Pharma. It's also insurance companies go after them and say they're overdiagnosing and things like that. So I think that's really important. That was one of the questions we were going to bring up was how many doctors that are treating Lyme are not taking insurance? Because you guys who are on here, a lot of you see my GoFundMe, right? Mm-hmm. They don't take insurance. So
yeah, unless you are willing to back down and agree that you have MS and call it something else.
Right, exactly.
Is what she's had to deal with.
Right.
Why do they want to push you toward MS? Because of the drugs that they prescribe for MS?
Yeah, they can give her a lot of drugs.
It goes deeper than that. It has to do with the insurance and everything.
There's a code for it.
There's codes for it, right?
Oh yeah, I mean, largely the insurance world is largely not that doctors, aren't open to taking it.
Right.
It's that insurance companies don't pay them, and nobody in this human world can afford to. We all have to pay our own bills, so nobody can really work for free. And if insurance companies aren't going to pay, then we're just kind of forced to pay, basically in order to keep doors open, saying this has to be cash based. Yeah. And a large part of our medical world is really run by that kind of broken concept.
I know that your office, they'll give you a super bill.
We'll give super bills.
But I can't put a super bill into Medicare because then but then Medicare comes after. See, Lyme. So they'll come after you and say, well, you have to take Medicare. It's the government, blah, blah, blah. And the thing is, you don't have to take Medicare, right? And so it's not worth it for me to even try to go after that, and so people like myself, they have GoFundMes or they have other ways to try to raise money for this and make awareness of this, because a lot of people have said, well, why don't they take it?
Yeah, it's simple. It's an unfortunate thing.
It's an unfortunate thing, and it's deeper than the doctors saying, well, I just don't want to take it.
It is.
It's the insurance companies.
It's the insurance companies don't pay. So the doctors, most doctors we can't take it for these complex things because of what I mentioned. It's like we can't take something that's going to basically result in us essentially working for free. Right. And
that's not fair because she went to school for a long time.
I have a lot of debt.
She has a lot of debt from going to school for a long time. So.
Yeah.
Well, we had brought up something earlier that, you had said that it was definitely on the rise. And I had asked you, do you think it was on the rise as much as they're saying it is? Or do you think the awareness of it is also on the rise and it's playing into the higher numbers?
I think both. I think absolutely both. We certainly have more awareness of it. There's certainly a lot more Lyme literate docs out there that are making these diagnoses, certainly more people like you guys that are basically helping spread the word. So the awareness is a big thing. And then the other thing to mention that we talked about before this episode was that we have these songbirds that are basically carrying thousands of larvae of infected ticks and flying all over the country. And when they, as gross as this is, when they defecate on Earth, then what's happening is they're actually dropping thousands of larvae that are basically turning into these affected ticks. So we know for sure through these songbirds that it is indeed spreading, and this is something, you know, you can read about in research papers online. So I think it's both.
And I'm thinking of me myself, of all the bird feeders that attract songbirds.
Yes.
I hear them every morning. I'm like, oh, the songbirds are back, and then I'm like, I'm all. I did, you guys. I never knew about the songbirds until I heard her last webinar, and I was like, oh, God. I had no idea. I had no idea.
Yeah.
Oh yeah.
Yeah.
I can probably go to 10 people's house right now that not only have plant feeders for songbirds, but they've planted flowers for songbirds and everything.
Yeah, they're beautiful.
Yeah.
You know, they're magical to have around, and some of them
they
are
just
carrying
have toxic poop.
Totally.
Well, what are some of the treatments?
He's not smiling.
I'm not.
You're like, I'm like,
Well,
I would be smiling right now either.
I like birds.
Yeah.
And it's sad news.
It is sad
I know,
news.
it's very sad.
If you want to learn about stuff like this, go to Google and then Google PubMed, PUBMED, and then search PubMed for medical information.
Oh my God.
And so yeah, here's a paper that calls out the American robin and the common yellowthroat, golden crowned sparrow, song sparrow, Swanson's thrush. You know, why don't they call out starlings?
Right. That's a good question.
Yeah.
Maybe they're not part of the spread.
Stacey knew all about this. She was like, how can you know about this?
I still don't understand is there a symbiotic relationship between these bacteria and the ticks, or
I think he's asking why would the ticks pick up that bacteria?
I don't know the answer to that. I mean, we know that classically these insects are just vectors that spread disease, but why they tend to do that, I don't know. If it's the infection, the Borrelia is providing something for it. I don't know the answer. It's a really good question though.
Well, what's interesting is that a lot of people think Lyme started in Lyme, Connecticut, but it actually started in Europe.
Right.
Hundreds, if not thousands of years ago. I mean, how are they finding Borrelia in mummies? Right? How are they finding it in mammoths? Like, they're finding it in mammoths that they're like in their bones and everything.
Right.
Right? So, I mean, it goes way further back than just Lyme, Connecticut. That's a whole nother thing that we won't get into today, right? But the strains have come across. They could have come across on the Mayflower. Like, who knows? Mm-hmm. And they are coming across on birds and the mice and whatever other little rodents are coming over, you know?
Yeah.
I think it was British sailors.
Maybe.
I'm Scotch, Irish, English.
Now we're smiling.
What's your background? Just kidding.
Well, we know the basic. We've all heard of, the rounds and rounds of antibiotics.
Yeah.
You hear Lyme, the first thing you think of is horrific antibiotics. But you keep bringing up herbs.
I do. Mm-hmm.
And that's a refreshing change. Can you enlighten us on what type of herbs you use in your practice to help us with Lyme?
Sure, absolutely. So basically, as far as herbal medicine goes, I mean, I treated myself completely with herbal medicine, as well as some injection therapy for Lyme. It's what I use for the majority of my patients. So this thing that we have to use antibiotics, for sure, that works for some people, and that's the right thing for some people. But I really think one of the most important things is that we're not saying that it has to be any one thing, because every individual is different. And I see people that, that antibiotics certainly make people worse and not better. Mm-hmm. So a lot of the herbs we use are things that you find in Buhner's work, things like Uncaria, Japanese knotweed, are really great herbs, and we combine things in ways. So we actually have our own formulations in our clinic that we use, as well as using other great companies out there, such as Clean Heart's work, the BioPure, and Byron White, and some of these other companies. And what we do that I think is one of the most effective strategies is it's not just about like what herbs we're using, it's also really about how we're rotating them. So we rotate through various herbs on about every 1 week to 10-day time period. And about once a month, we're actually taking about a week off where we're purely just building the body up. And this is where I think whether it's herbal medicine or antimicrobial medicine that we can get really off track, because anything that kills, whether it's pharmaceutical or herbal, is still really potent. And
it is.
It's, you know, some
Totally is, yeah.
So some of these things, if we're just killing, we're forgetting about building the body up, building those reserves up that often have gotten so out of balance, and really allowing the body to have the strength to heal. So that's a large part of it. And
so would you suggest people, sorry, I don't know.
No,
I was like, oh,
please.
I don't know if she's done. So would you suggest that people like myself come to see you who have been on antibiotics on and off for 30 plus years, right?
Yeah.
Even if it's not just for Lyme, even if it's just for bronchitis, like if you have chronic bronchitis or pneummonia all the time, once a year, should they come and see you so they can go through that build up process?
Absolutely.
To build up or help their body?
Absolutely. Yeah, I see really commonly that we're just focusing on one area within the body. And, you know, and I see some challenge with that, in that if there's a problem in the hormonal system and the adrenals and the gut and the cardiovascular system, it's going to be very difficult for us to maintain health or even reach health, even if we've done a great job of treating the Lyme. So I definitely recommend people take that holistic response. I'm certainly happy to, you know, to be that person. We do treat people via distance, so, you know, that works really well.
By the way, what's your website so people can go on and get their 15-minute free consultation?
Yeah, so if you want to come on and get what we call the 15-minute discovery call, you can go to, it's Living Love Community, so it's livinglovecommunity.com. And there's a very, very easy to see big blue button that says 15-minute discovery call, and that's how you book them.
I really enjoyed your website when I went on it, because, you know, you
so
go
fun.
do a little, you know, homework and checking it out, and I ended up being lost in a couple of your podcasts and watched several of them. So you have got a lot of resources, you know, for if somebody's searching.
Absolutely. We have a great blog. We do a lot of, got our Facebook page, which is Living Love Community on Facebook. We do about once every 7 to 10 days we put out a Facebook Live. So we're really working on our YouTube channel right now too, getting a lot of material out there. So education's a huge, you know, part of our mission is really just helping through education. So even if you're just interested in getting information, please check out the blog. It's you know, we update it regularly, multiple times a month. We're putting new information out there.
And can they oops, sorry.
Oh, go ahead.
You had mentioned earlier that you were going back and you were watching the webinars because they're free.
Yes.
So everything on the website doesn't cost money, so why not go in there, right?
Right.
Read the blogs, or listen to the webinars again, and you'll probably find out a lot of stuff that's not even Lyme. You'll find out about other things too.
Absolutely. Yeah, we talk about a lot on there.
Yeah, you do.
Yeah.
I know, right?
Yep.
Well, I know I made sure I liked your page and followed it,
good.
because
Yeah.
in the past few months, you've had some interesting classes and different outreach to the community that I could see would benefit a lot of our family.
Yeah.
And
Yeah,
our
we
watchers.
do that a lot. Yep. Talk at coffee houses that are local, and you know, every once in a while smoothie shop or those types of things. So yeah, just get on our Facebook page. We post all that on there.
Nice.
So for the CannaFam, we talk about the CBD
Yeah.
or CBG or CBN, whatever, and then also THC if you use any of that.
Sure. I mean, my feeling on cannabis is really where I see in research is very similar to I see with a lot of other plant medicine, which is the best magic is in the whole plant, right? And so anytime that we're extracting, you know, constituents, we're not necessarily allowing for the all of the phytonutrients that are actually active in the plant to do their job. Now, you know, there's definitely a lot of research on CBD, and for some people having the THC component is not a good choice for them. So it's really wonderful that we have these options because it's clear.
Everybody in the military, everybody who has to pee in a cup, everybody who works in a warehouse or drives a truck, or anybody subjected to any sort of random drug testing.
Yes.
Or people
That's
that
your choice. That's why
don't
we
live
make
in a legal state.
That's
Yeah.
well, even if you well, yeah.
Right.
So,
I mean, I take CBD with CBG in it, and it's really helping me. But I didn't even know. Like, I didn't know until I had run into this other company that provided that.
Steve's Goods.
It's not Steve's Goods, but Steve's Goods I heard is very good. Prime My Body is what I'm taking, but it is THC free. So, and they're extracting the THC in a way that, that it's not detrimental to your body.
Right.
But
so that's a
because
good
there are some, and I heard Steve's is great for that too. That because he's THC free too, right?
I don't know.
Oh, I'm not sure, but I do agree with the whole plant.
Yeah.
But I do agree with what you're saying, because we don't want to send somebody down a take whole plant and then all of a sudden you test positive.
And we see very clear research on even just the isolated cannabinoid, the CBD, and how amazing that is for sleep and anxiety and gut issues and inflammation and on and on and on and on.
Yeah.
So it's wonderful that we're now at a point in our legal system where we're starting to use this plant that actually has a lot of amazing medicinal properties to it. I think one of the most important things I want to say here is I have a lot of clients that use cannabis, and some initially will have like a really positive reaction, and some that will initially have a more negative reaction. And one of the things that I think is really important to know is that there's so many different strains out there, right? So to say that we're just going to have a bad reaction to one strain of cannabis is in so many ways similar to saying, well, I took echinacea, so herbal medicine is out.
Right.
So it's really in talking and doing education and talking to people that like you guys that know these different strains and plants so well, that I think can be really useful, because it really does depend person to person which strains are actually going to be positive and helpful, and which strains might just not work as well in the system.
Well, in delivery systems too.
Absolutely.
We tell people all the time, start slow, work yourself up. But it also goes, maybe someone doesn't like the way their body feels when they ingest it.
Right.
Well, what about a transdermal patch?
Right.
What about a topical to relieve the pain? You don't, so there's a lot, like you said, you can't just judge by one.
Absolutely. Absolutely.
Right.
So, well, did you have any more? Did we cover everything?
No, we did not.
We did not?
We did not.
Travis is like, I used to drive Jenny to every single meeting he did when I was waiting to get my hand controls. So you probably have more questions.
Well, if you Google Lyme and cannabis or Lyme and cannabinoids, you get all of these articles written by people saying that, is cannabis the future of Lyme disease treatment? It was a miracle cure. But like I told you earlier, go to Google and then Google PubMed and then search PubMed for Lyme cannabis, and you get one result. And if you search for Lyme, and it's about dermatology, and if you search for Lyme cannabinoid, you also get one result.
I don't want to sneeze.
And so there's a paucity of information, of scientific research available to us. Like, compare that to, they say that every time they say there's not enough research on cannabis, there's way more research on cannabinoids than there is on acetaminophen. We've proven that on other shows.
You writing down the number?
Yeah.
Yeah, the patent number.
The patent number.
Just in case. But, so are there groups, like, who's working on this? Are there universities working on Lyme? Like, who's torturing ticks and figuring out how to kill them and stuff, and who's figuring out if Lyme disease kills ticks, and is like Israel leading the way in that? Is the Dutch doing something about it?
I'd say over in Europe, from what I've heard from the doctor I was speaking with this morning, he said there's a lot of research going on over in Europe right now, but I don't think we're really doing it here.
No, I think we're still not super aware of the level of problem that it is. So,
because it's not like I don't want to say AIDS, but I'll just say AIDS. Like, it's different from a communicable disease, right? And so when AIDS came out, they're like, we're gonna find a cure for AIDS. Hundreds of thousands of millions of dollars.
They dragged their feet on that for a long time.
Well, they did, but you know what they did? But they were gonna find something, right? They haven't really made it for everybody, have they? To fix to do what they need to do for AIDS, but at least
People are
they
living
have
with
something.
it.
But yeah, people are living with it. With Lyme, people, I hate to say it, but people are dying. I mean, people are dying every day. I think I just read like 20 people a day are committing suicide now because their pain is so bad and they can't afford to get better. And so don't worry, I'm fine. I'm not going to commit suicide. Everybody knows I'm too happy to commit suicide, but I just don't think that we're putting the research out there.
No, not that I haven't heard any organization that is dumping in. And if anybody wants to prove me wrong on this, please do, because I would love to know if that organization exists.
Live Life Foundation, they're raising money all the time. So maybe, I know that they're the ones that just had that bill go through or start in Washington. So, there are 501c3s, there are foundations and everything, but I just don't know where the money's coming from.
Yep, I agree.
And I didn't find any that was really for research. When I started looking for Lyme organizations, I found support groups and organizations like that would, have walkers and assist with that sort of thing, but not research.
Yeah, iLads is certainly doing, I think, some of the best job out there of just gathering the research and getting doctors together and doing training. And I think they're one of the better organizations that's out there that exist. And
I remember, I was like, it's IL, and then I couldn't remember the rest of it. I was like, dang, I said it the other day. But there are some organizations like that, but they're kind of run by the CDC a little bit, aren't they?
Yeah, they're definitely fairly conventional as far as like treatment and that sort of thing, but not necessarily completely conventional, because they're still using even antibiotics from a very non-conventional type of way, and definitely are doing a lot for spreading. They're doing an amazing job of spreading the awareness around that this is actually a real problem. So I think we're really lucky to have that organization. And
I do too.
I think though, in answer to your question, I don't know of anybody that's like largely funding the research that needs to really happen here.
How about the Gates Foundation? Let's get Bill Gates. How about, you know what? You're in Washington State. Lyme is rampant there. That's where Klinghardt is. Why don't you just pull some money in, right? You throw some money into a foundation that you can just like make up, right?
Yeah,
but
that'd be great.
I think there needs to be people like that. Warren Buffett. I don't know if these families have been affected by this.
Well, until we get the medical community to all agree that it is or it isn't, and put pressure on the insurance company to cover, treatments and what have you, then I think it'll go from there. But until we get that, because right now you have doctors who are adamant that it doesn't exist and it's just a made-up thing, and then you have
I know how to test that. I know how to test the firmness of their beliefs.
Let them get it.
Yeah, let's put them in a like a plexiglass box with a whole bunch of ticks.
With a fogger machine. With your fogger machine, right? I had to bring in the fogger machine at some point.
Yeah, if they don't believe it, then just get bit by a tick.
Right? Yeah, that's a good test.
But President Bush was bit. He had it.
Which one?
Baby Bush.
Baby Bush? He had Lyme? How did he get rid of it?
Who knows, right?
Money. He got rid of it with a lot of money. I can't. I didn't know that. I didn't know the extent to which insurance just wrote you off. I didn't. We've been, talking about the GoFundMe and posting it and stuff, which the link to Jenny's GoFundMe is in the description of this video, and we'll also go back through on Facebook and post it everywhere there too, as well.
My poor family's my parents, they did what they could do. Everybody knows, for the most part, as when I'm speaking about Lyme, I always say the doctor that really sent me to the Lyme doctor was a doctor at Michigan Division for Dow Chemical. Everybody's like, oh! And I'm like, yeah, but you know what? I'm alive because of him, right? So my parents' insurance was through Dow, and they were paying for it. And that's before the insurance companies started going after the doctors.
Right.
So my original doctor, the state of Michigan went after him, and he can't practice Lyme anymore. But he could do everything else. Yeah. So, I mean, I lost my doctor in Michigan, or in New York, who was like the doctor, right? They went after him 4 times, and he closed down his practice. He's like, I'm done. And he was the big researcher. He was like the big researcher, right?
Right.
I think he still is. I think he's still doing stuff. You can look him up online, but those doctors who are like the doctors that really knew what was going on, and they had kind of the backstories and stuff. Those are the ones that are taken down.
Yeah, it's true. It's true. It's affecting them too.
Yeah,
it's a scary world a little bit.
Yeah. Because all they have to do, all the state does, is they go in with the pharmaceutical companies or the insurance companies, and like, oh, well, they thought maybe she had lupus, so she was misdiagnosed, or oh, maybe she has MS. That was in there, so they shut them down. So those types of doctors have to take me out because they know the insurance companies are going to come after them.
Yeah.
Nice, right?
Yeah. Yeah.
Well, you know, I mean,
yeah.
You've been through enough stuff too.
And, you know, I know another lady with Lyme, and she basically has had to allow her medical records to have a misdiagnosis. She had to agree to MS. You know,
treatment.
To get treatment.
Yeah.
Yeah.
You know, so she's on MS drugs that aren't working for her. You know, and in that frustration that are killing her, making her worse.
Yeah.
You know, but there's not a coding for it.
Yeah, exactly.
Right.
Yeah, now we're in a world of codes, not people.
Yeah. Well, I thought it was funny. My neurologist had to put hemp oil on mine because there wasn't anything for full plant extract or anything else on there for cannabis.
Yeah.
There wasn't even cannabis in her coding, just hemp.
So she had to put that in her records.
That's what I was taking. She had, they have to put something in there.
You know what they do say to me? They say, "We're just not going to say anything." Like they don't even put it in there. Like, not going to say anything. Like the place where you picked me up, they have nothing in their records that I take that. I wasn't taking it there. I wasn't taking it there.
I picked you up many places, Jenny Gold.
Now the last place you picked me up, babe.
Yeah.
No, because I had to go into a facility for physical therapy. But they said, no CBD. Do you have CBD on you? I'm like, no. And I didn't. Well, I kind of lied.
Okay, just for your lips, though.
Just for my lips, though, right?
Yeah,
we have to give a shout out to
Flora. Yes.
Flora, I had your lip stuff in the facility.
Her root balm. We have a really
awesome.
good friend of ours that has an amazing hemp company. Veedverks carries the line, but she has hemp teas, and she has a dog line of treats and tinctures.
The dog stuff works.
She has been really pioneering out there, going for the root of the hemp ball. We know there's other medicinal qualities in the root, so she makes a really good balm out of that. And it works really well. Yeah. Especially for really chapped.
AC was like blowing on me for 9 days, and I was like, can somebody please bring me my root balm? And they're like, well, your lips aren't as bad. I'm like, I know, right? I'm like, I don't know why. But yeah, so a lot of places that are federally funded, I don't even know what to call them. Well, hospitals and in-home place or outpatient places where you live. For a couple days, for like 9 days or a couple weeks, they're federally funded. So they're saying CBD is not legal.
They're wrong. CBD is totally legal.
They said it is not
the
legal
Farm
and
Bill,
we're federally funded.
2018 Agriculture Improvement Act of 2018 descheduled hemp, and it defined hemp as cannabis sativa L with less than 0.3% delta-9 tetrahydrocannabinol on a dry weight basis, including all of its extracts, isomers, salts of isomers, everything that you can squeeze out of that plant. And it even says cannabinoids, as long as it doesn't have that delta-9 above 0.3%.
Even the hospital.
Hemp is all kinds of legal. If we weren't on to other things that day, I kind of wanted to stay there and fight with them a little bit.
I was like, no, we need to go. I've been here 9 days. Yeah. But Travis and Julie are two of my best friends, and I was like, thank you for taking care of me. I'm going to make you banana bread now because I feel bad about that still. But I know, right? But yeah, I'm telling you guys, if you run into a hospital for some reason, they thought I had a stroke, but I didn't. They will say to you, "Do you have CBD? Do you have THC?" I smoked 3 puffs on a Friday, and on Wednesday I was in the emergency room, and they said, "That's why you fell." And then I said, "Well, I had CBD too," and they're like, "That's really why you fell."
Oh my gosh.
Right? Oh, Travis was about ready to like lose it. I was like, "Oh Lord," right, Travis? Are we getting any good things over there? They're probably saying Jenny's just like.
No, you're good.
I'm not good at reading comments.
We'll go back through and read them all and answer all the questions and what have you. No, that just is so irritating to be treated like that. You know, like that's another thing that irritates me is first thing they want to say, "Oh, well, you've had too much marijuana. That's why."
Yeah.
You know.
Yeah.
I'm like,
and it was days ago.
I was like, what?
And that to me like takes us back to a point of like really listening and really believing and paying attention to our patients and just not kicking them out the door in 5 minutes or less.
Is it time for this yet?
What's this?
Oh, I just got it in waiting in case it.
You're waiting?
No, I just have it ready to go.
Well, I feel like I just yep.
The U.S. government has a patent on cannabinoids as neuroprotectants and antioxidants. It's patent number 6630507. You should Google it, and there's a Facebook group. Talk to the 6630507 hand.
Hey, Amy, we love you.
Join us. Amy Dawn Berlin Hilterbrand, also founder of American Medical Refugees, which that's not an official AMR sticker. We just made it because we like stickers.
I had one I could have brought.
That ought to be.
I didn't think of it.
Useful. So that bullseye rash.
Yes.
Is that the bacteria replicating inside you?
Thought that it's the spread that's causing that.
What system in your body is it using to spread? Is it going through like your lymphatic system or your capillaries or like? It's
using a few. It's definitely going in your in your blood. It's definitely in your blood, but then it's getting intracellular too. So it's doing a couple of things of spreading, but then it's also going deep inside the cells. Then, where after a certain amount of time, you can't even detect it in the blood very easily because it's so much inside the cells. So that's why like certain tests, for example, like PCR tests, where we're looking for the DNA of the Borrelia, there's techniques like deep tissue massage or exercise or other lymphatic work or even ultrasound that are being used prior to doing the test. And those types of techniques are basically being used to liberate the Borrelia from the intracellular compartments back into the blood, so that whether it's a blood PCR or a urine PCR test, it can actually be found.
How hardy is this bacteria? Like, what temperature extremes can it withstand?
I don't know that I know the temperature.
Could you go to like Cool Sculpting and have them hit that bullseye rash? I
mean, I know one of the things they're doing in Europe is hyperthermia treatments. So, where they're raising the body temperature to 107, 108 degrees under medical supervision. This is not something we're doing in the States because it's fairly dangerous for other, other reasons of raising the body temperature so high. And I know that's one treatment for Lyme and other things that's going on in Europe right now.
So the hyperbolic chamber, how would that, I'm going to start that next week, everybody. GoFundMe, please.
Hyperbaric. You go to the altitude chamber?
You're talking hyperbaric, I think, right? With the oxygen? Yeah, hyperbaric.
So will you talk about that a little bit?
I mean,
also ozone therapy too.
Yeah, I mean, certainly there's a level when we have Lyme and other chronic infections. There's a level of hypoxia that can happen in the cells, right? And so with that hypoxia, where one of the problems is and where the mitochondrial dysregulation comes in is the mitochondria, most people know as like the powerhouse of the cell, right? The part of the cell that produces energy, essentially. And in order to have that energy, we have to have oxygen. That's what allows that energy to be produced, as well as other nutrients like iron. So one of the things that ozone actually is O3, but it's delivering a lot of oxygen, a lot of the oxygen molecule to the tissues, as well as something like a hyperbaric chamber. One of the things that's doing is actually helping with that whole electron transport chain creation of energy in that powerhouse of the cell. So, and the other thing we just started doing in our clinic that I'm really excited about the research is a concept called photobiomodulation, which is big mouth. I don't know why we use words like this in medicine sometimes, but it's a big mouthful that basically it's essentially saying light therapy. So we know a lot about like far infrared light therapy. That's what we see in saunas. But the photobiomodulation is really looking at continuous red light therapy and near infrared light therapy at various wavelengths and frequencies. And what we're seeing is just like with things like hyperbaric chambers, we're actually seeing the mitochondria turn back on and that oxygen starting to happen again. We're also seeing the photobiomodulation reverse plaques in some of these dementia-related scenarios like Alzheimer's. So there's studies where plaques are being reversed in 12 weeks. That'll really very exciting. Animal studies to say that.
I'm just kidding.
What's that?
I'm already telling you, I'm going to do that too with you.
Yeah, yeah. It's super wonderful. It's a cool treatment.
Hold on.
Breathing ozone sounds like a bad idea to me.
The ozone therapy?
Oh, you don't want to get it in your lungs. Like ozone, you absolutely don't want to breathe it in. So there's ways, that's the one area of the body that is.
So she's breathing oxygen, but then the
I haven't done it
chambers,
yet, but I've been told
but the
that
chamber will be filled with.
It's oxygen versus ozone.
Yeah.
So ozone's O3.
Those are two different things.
Oxygen's O2,
I
right?
understand that, but
right. So so then let me understand. So where your what your question
I'm concerned about. You've got 3 oxygen molecules all sharing electrons in this weird way, and when one of those busts off, it's a free radical, and it's missing an electron, and it goes looking it for something else to take an electron from, and it creates a cascade of damage throughout your body.
So with something like ozone, so we can avoid the the respiratory thing because we're not actually doing anything. We're breathing in ozone ever. So ozone is delivered typically a couple different ways. One, we can do IV. We can also do things like suppositories, right? So suppositories are a really easy thing to do. Suppositories are basically where ozone is put into oils. Different oils hold different amounts of ozone. Hemp, interestingly enough, is the oil that holds the most amount of ozone. So we can use suppositories as a way of actually getting that ozone into the system. So we have a couple different things that will happen. We certainly do have an oxygenating of the mitochondria, and your conversation about the reactive oxygen pathways and those chain of events, certainly that can happen. But remember, reactogen-oxygen species, as I know, I think you guys know, is like that can be that really important part of killing things. Killing things, it often uses and actually is part of the reactive oxygen species pathway. So that's why we can get so much killing out of this, and we can kind of mitigate by some of those effects by taking things like antioxidants, vitamin C, not at the same time, because then we're going to actually mitigate the effects of the positive of it. But like for ozone, we can give a suppository, and a few hours later, then take some vitamin C to help mitigate some of the effects of the concerns you're bringing up. Yeah.
Okay. I just didn't want our Jenny breathing ozone.
Yes.
I might just do that for the hell of it. I would have probably done
It's one of my favorites.
Yeah.
It's one of my favorite smells.
Really?
Oh yeah.
I think it's a pretty funky smell.
Really?
I do.
That's funny.
Yeah.
Huh? Yeah.
It's the smell of rain.
No, the smell of rain is called petrichlor. Trees release it.
Whatever.
Yeah.
Over there, 'cause I wanna,
Go
John
get
Gray's
smart.
saying a lot over there. I just can't read it. Hi, John Gray.
No, it's John Corey. That's Guido sitting over there.
Oh, hi, John Corey.
Participating.
I thought it was John Gray. It could be.
So if you find a tick, step 1, freak out. No, step 1, don't freak out.
Don't freak out.
Don't freak out.
Step 2,
Remove it.
remove it.
And save
Step
it.
3, save it, send it in.
Step 4, then do you go to the clinic?
Step 4 is I would definitely get treated. Yeah, absolutely. If, and that's where it's just a personal preference. Like as far as do you do pharmaceuticals, not knowing if it's Lyme, do you not? My personal preference is I would, if I didn't know it was Lyme, I would not go down that pharmaceutical route. But that's just everybody's individual, personal preference there. If you do use pharmaceuticals, I would definitely use herbs too.
Yeah.
I wouldn't use just pharmaceuticals.
Right.
I'd rather get bit by a rattlesnake at this point than a tick. You guys have really gotten me freaked out. It's
I thought
Yeah,
you
it's
wanted
not.
me on here today.
I do want you on here.
I'm sorry.
It's Lyme Awareness Month.
Yeah.
And
Yeah,
and the
it's
thing is,
happening.
I've been posting limes do not drown. So if a lime gets in water,
The tick, you mean?
or what did I say?
The lime?
A lime.
Uh-huh.
Oh God, I just said the limes. It's almost as bad, right? No, if the tick gets in water, it can live up to 2 to 3 days. How? I do not know.
Right.
All I know is that it can. I got that from the Live Lyme Foundation thing that they put up. And then the
Ticks.
other thing is, you guys, they don't freeze in the middle of winter. They hibernate.
Right. Exactly.
And we have the craziest weather here. So we've got, here we have winter and it's, negative 10 degrees. And then in 3 days, it's like 50.
And they're back out again. And I forget.
So
I looked this up at one point. I don't know if you remember this. I looked up how long it has to freeze for them to go into dormancy. And it wasn't just immediate. I don't remember the
It's
exact
not
amount of
immediate.
time, but it wasn't immediate.
I don't remember.
where do they hibernate?
They just they go
In trees,
deeper
into the
deeper
ground?
into the
In your hair.
into the
In your
brush.
hair.
They just go deeper into the brush. So if like
Hey,
you're on a
Peanut Gallery.
trail, it's
He's
like,
gonna freak
it's
out.
very, dangerous, we could say, to walk closer to the grass on the trail. They'll just tend to go deeper into the brush.
But if you have like logs, like wood logs for the fireplace and stuff, and you haven't used all of them and brought them in,
Yep.
they can just go in the log and just say, well, I'm going to go under that.
Well, there are all kinds of insects do that.
Yeah, right?
Yeah.
And not any insect
Got
can
it.
do that.
Yep.
So they can go on the side of your house. I don't know. They could go anywhere.
Yeah, this is not to freak anybody out though. Like one of the
Sorry.
things I really feel like
We didn't want to
is-
do that today. That serious. I've
No,
been trying to be
we're
really
raising
good about
awareness.
We're raising awareness, and one thing that I think is really important is that these bodies that we have they're really good at healing themselves.
that. They are.
And sometimes we have to figure out what they want and what they need in order to give that support. But even if you do get Lyme, it doesn't have to be this death sentence. Like the body can heal. And the sooner we know,
That's true.
the sooner we treat it. It's like,
Mhm.
you had it for years before you knew about it, before
I
you
probably
started
even had
treatment.
it before Mexico. That's
Right.
the thing. We think I got it in the UP of Michigan. My cat had it. Like, poor little cat had it. Right?
Right. Yep. So,
But we didn't know until they figured out that I had it. Then they're like, oh my God, the cat had it, because the cat started getting sick. So, that was probably when I was in high school. So, there's a really good chance I could have had it since I was laying out in the grass in my yard in Michigan. I don't know.
Before the Mexico tick bite.
Yeah.
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 Because doesn't it sometimes lay dormant?
very much so. Very much
So it's hard to really
Yeah.
pinpoint when, where, how.
Oh,
Exactly.
Yeah. It can be
Exactly.
many years later. So we have strange neurological symptoms, migrating pain, headaches, fibro, chronic fatigue, and we can't figure out why.
Why?
Right.
Yeah.
Yeah.
Exactly.
Those are all
It
red flags.
Could be
Yeah.
you got bit as a kid.
Exactly.
And
That's
then
exactly it. I went on a camping trip in high school, right? And I started getting sick after that trip, but I didn't really realize it. My parents remember this, but it's kind of like the nurses were calling and saying, oh, now she has a fever again, or oh, now she kind of has this going on. And so I probably got it on that camping trip. Like, we have no idea. We know I got bit in Michigan or in Mexico for sure. But was it before that? Probably, if the cat had it,
Right. Absolutely.
how many ticks have you ever had on your body? Have you ever had
A
one?
few. Not
few?
not a ton.
How about you?
Uh-oh.
Louisiana.
All right.
going through
All right, let's just put it like this.
I know,
All right.
right?
Raised all over the country. Very outdoorsy kind of kid, but raised my children in South Louisiana. I'm a wood artist, so I will jump out of a boat and go with a machete and chop down vines. And I can't even count how many I've had.
Oh my
on
gosh.
me.
Sorry.
And then, we hunt and fish. Of course, I always check my kids, all
Yeah.
the crevices and stuff
Right.
like that.
Thank you.
And it's just a common thing. It's like seeing a fly,
Uh-huh.
Mm-hmm.
Yeah.
in certain parts of the country.
Right.
There's so
Yeah.
many
sure.
of them.
Do chiggers spread Lyme disease?
I
I don't know.
Speaking of
I looked that
crevices.
up, and I don't think I saw that.
Yeah.
I think I saw that they don't. But I don't know
not-
why.
Just
not
fleas,
read.
mosquitoes, and ticks.
Those are the ones I've seen.
And songbirds.
and
And songbirds. Yep. It's true.
Sand fleas.
Sand fleas?
Well, those are fleas, but
Mm-hmm.
there's fleas for cats, dogs.
There's not a
You
whole
know.
lot of fleas in Colorado, though.
I don't know about that.
Oh,
Oh, here. Thank you.
You're such a gentleman, Guido.
You are such a gentleman. We have a peanut gallery over there, and he's really helping us.
Uh-huh.
today.
You get Lyme disease?
How glad are
No,
you?
you will not.
How glad are you that you didn't know about Lyme disease in Siri
Oh my
in
god.
survival training, and that would have
Yeah.
Are you
driven me
trying
crazy.
to give me a panic attack?
Well,
You can go
Yeah,
and
that's
see
a
Dr.
good
Mueller,
point.
and
Just
she'll tell
keeping
you
it
whether or
real.
not you have it.
I don't.
I don't think you do.
I
I don't think you do. I don't think you. Well,
Positive mental attitude.
There you go. There you
I don't
go.
know. I don't
That's what I said
know.
about the mind.
I'm gonna say no. It's all. You know what? I think a lot of this, when you are bit, or if you are bit, period. I think a lot of it you can probably correct, like you just said, with your mind.
The
If you're
mind plays a
healthy,
big
the
role.
thing is, if you're healthy, I mean, I grew up dancing. I was a cheerleader, whatever. But you know what I mean? I was very active. I was a skier. And then you go to college and you're like, wee, and you're having a great time, right? And you're partying and you're not sleeping a lot. And then you decide you want to have 5 internships and they have to be with the best companies, right? And you're under a lot of stress, right?
Stress can bring it out.
It was a lot of stress, and I always wanted to be the biggest and the best. And I did not help myself. All my doctors always said, can you please get a job that's not so stressful? I'm like, okay. And I'd go in and I'd say, hey, got a new job. 20 times more stressful. They're like, what are you thinking? I'm like, but it's so cool. It's
Yeah.
the largest company in the world. You know, you're like, so
what kind of job isn't stressful?
exactly. If you work for Nick Muir, because he's a great boss. Hi, Nick. I know you're watching. No, he really is, right? Or if you work for
Nick
Travis.
Muir is
Yeah.
an awesome guy.
yeah.
Whitlon.
Mm-hmm.
Or Whitlon.
Whitlon.
Whitlon. Check him out if you need cannabis related business services.
Yes. So, but if you are ill with any chronic illnesses, please, 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 like, just try to figure out a way to get your stress down before it's too late, because I did not do what I was told to do. I didn't. And I think that's really important. So
Yeah,
if they say you
matters.
need to bring your stress down, you really need to.
It matters.
You know
then you
how
might
I
turn out
like
like
to bring
this.
my stress down? Is by rotating my herbs like you talked about. earlier.
Or your
That
or
does
your
it.
vape pens.
From the left.
Yeah, those,
Right?
those are good for
That's how you.
those are good for anxiety.
Mm-hmm.
Yes.
Absolutely.
And I really want to do a shout out to Veedverks, because I've known Travis since we both kind of got in this, right?
2014 probably.
Yep. And Veedverks has come a long way.
It's exciting, you guys.
I know, right?
Mhm.
So thank you for having us today. And Julie, too,
You are so welcome.
because we love Julie. And she makes a really good turkey, by the way. And she makes a really good succotash type of thing. That came up on my Facebook yesterday.
Did it?
Yeah. Succotash.
Well, you know, and it kind of goes along with, you know, I want to really encourage everybody to check in on each other, you know,
Yeah.
because there's been times where she's called me and she goes, oh, yeah, well, I fell and And I'm like, and you didn't call me to do this? And, you know, a lot of times when you're sick and you're not feeling well, you're not going to think about calling somebody and imposing.
Right.
So you have to make it, you know, a priority to check on your people,
Absolutely.
you know. And even if you call them and they say they're just fine, you know, if you got that gut instinct,
Follow
you
it.
know, follow it.
She does. Or I call
Oh,
her
I-
and I'm like, are you okay? You're like, no, I'm not. And I'm like, okay. All right, tell me what's going on, you know? And I do think that's very important. And it was, Travis knows I was bawling when I put out my GoFundMe. I'm like, oh my God, I can't do this. And I'm like, I didn't want everybody to know I was this sick. He goes, we've known.
Mm-hmm.
We've seen you. We've seen you get worse.
Well, no Kane, no Kane, no Kane, Walker.
Yeah.
Right?
Pretty soon it's going to be mechanized armored suit
I know, right?
anti-tick device.
That was just one way of going.
But I really believe when I start seeing Dr. Mueller, which she's going to go through my paperwork today and go, I don't think so, right? Hope she doesn't say that, right? That I will get off of this as soon as possible. And that was my goal. When they put me in this facility, when I said it was rehab, everybody said to me, I didn't know that you had an issue with alcohol. And I'm like, no. I'm like, no. I know, right, peanut gallery? I'm like, no. I said, that is not it. I said, it's for physical therapy. And my goal there was to get off of the walker and to use my cane again. And they said, okay, that sounds great. And then after 9 days, they said, well, maybe not yet. So,
Yeah.
but now I'm moving forward and I'm finding new. And you guys, I really apologize because I know my GoFundMe, I'm kind of like here and there and everywhere else. But what's happening with Lyme, as you're finding out today, is that the treatments change almost as often as governments believing in CBD or THC, or states all of a sudden in Texas saying, oh yeah, you grow hemp now.
Mm-hmm.
Right? I mean, this happens.
Did
The Lyme
Abbott
stuff
sign
comes
that?
up. Huh?
Did the Texas governor sign that?
I thought he did.
I didn't see it.
Was it today?
I don't know. No, I just
No. I thought that happened
passed
the
the
other
House
day.
and the Senate unanimously, I think.
Yeah.
But I hadn't seen that the governor had signed it.
Oh,
Yeah.
Grow hemp,
Sorry.
Texas.
can somebody please let us know who's writing in now? You can let us know.
And you guys, I hate
But-
to say this, but I've got patients all
I know
afternoon.
you do.
I know.
I'm starting
And
to
I-
get you at
Gotta get
3. So
I know, right?
I've got
We've been on here for quite a while, haven't we?
Well, thank you both for coming and sharing information with us about Lyme disease.
Yeah, thanks for having.
Thank you
Please,
for coming. I really
Spread this
appreciate
out.
you.
Subscribe to our YouTube channel. You can find Dr. Mueller online at livinglovecommunity.com. Do you have a URL you want to? What's your Jenny's
I don't know.
GoFundMe?
I'll
They
put
can
it
go.
on
They
there.
can go to teamjennygold.com,
TeamJennyGold.com.
and then you can find the GoFundMe there. And if any, and guess who's having a fundraiser for me on July 27th?
Who?
Elise Gordon Holtz with Better Baked.
All right.
Yay! Right? And only 30 people. There's only going to be 30 tickets. It's $150 a person, and we are looking for donors for the gift bags. And if you want to be a sponsor and have your banner up, it's $150. Well, we're still working on that. I'm going to say like $125, $100 for almost. And you can also put something in the bag. If you want to put things in the bag, only that, that's $50.
When is it?
Is July 27th.
July 27th.
And guess what?
Chicken
It's
bite.
it's called my rebirth. She's calling it the rebirth because somebody's having her big birthday on the 29th of July.
That's right.
That'd be me.
Exciting.
Yeah.
So you need to get me off of this by July 29th, right?
Yeah.
So so it's really exciting. It's going to be a eclectic dinner. Elise is going to do the cooking, and we may have another person coming in to cook also. And if you want infused, we'll have it on the side, but most of it won't be infused. You can just like put your own stuff on there, and we're really excited. So she's going to start posting what else the other types of things we're looking for sponsors for. So we hope to see you all there, but only 30. And if you want to bring your spouse or your significant other, it's going to be 2 tickets for $275 or $250. I don't remember. Sorry.
Well, we'll get it all straight.
We have time.
Yeah.
We do have time, but not that much time.
Yeah. We got to get the
Right.
doctor back to
Anyway.
our office.
Thanks for
Thanks,
joining, everybody.
everybody. Bye,
Thank
guys.
you both for joining us. Thank you,
Thank you for
Julie.
coming.
And as always, I'm Travis Lippert, reminding you, if you don't get hemp here, get hemp